There have been a lot of recent proposals for reform to the star rating program, and I'm curious, what would you want the people advancing these reforms to take away from your findings in this paper?
One of the pieces that come out of this paper is thinking more deeply about the criteria that CMS uses for selecting measures and deciding which measures to phase in and out. There are obvious measures like criteria, important to patients and families, what's a valid measure, reliable measure, one that can be influenced by health plans if their action can do something about that aspect of care or managed care. And CMS, I would say, they select measures based on what they believe to be actionable and attributable to plans. But in practice, some of those outcomes are much more directly within the plan's control than others, as I mentioned. I think one of the main issues is that if we find that a measure, for instance, has not been improving for a long time, how do we decide whether or not it is a ceiling effect or if the incentive isn't enough compared to what they could do in other measures? So I think also thinking through the level of difficulty and the amount of resources that are required for a health plan given its locus of control, that should be a consideration in the selection of measures.